Welcome to the Grande School District Town Hall, where we're going to be discussing our reopening for our school district. My name is George Mendoza. I'm the Grande School District Superintendent, and we do have special guests joining us for the Town Hall meeting. We'll start with our school district staff, and we'll go with Scott Carpenter first, and then we'll go into our public health officials, and we'll end also with Grande Hospital's Dr. Zach. So go ahead, Scott.
Scott Carpenter, Director of Education Programs for the Grande School District.
Landon Braden, Director of Student Services, the Grande School District.
Dalton Sheets, the Grande Education Association President.
Chris Wagner, Vice Principal, LeGrand Middle School.
Kyle McKinney, Principal of the Middle School.
Hi, everyone. This is Carrie Bergetti. I'm the Public Health Administrator at the Center for Human Development here in Union County.
I'm JB Brock. I'm the Union County Emergency Manager.
And hello, everyone. My name is Dr. Zach. I am one of the pediatricians at Grande Hospital Women and Children's Clinic. Glad to have you here.
Well, once again, I'm really thankful for all those that are here in attendance, and I'm hoping that you get a lot of information out of our presentation. I'll read this information briefly so that you know a little bit about the question and answer portion of the town hall. So over the last 24 hours, we have been monitoring questions that have been coming to the district about our fall reopening plans through our new email at reopening@legrandsd.org. While all the questions are important to us, we will be responding to trends that we've seen in the questions that we've received during this event. If you have specific questions regarding your student, please contact their school to get the best individual answer. We will not be publicly answering these types of specific student questions during this town hall. Lastly, we will continue to monitor and respond to questions that are sent to reopening@legrandsd.org. After this meeting and responding to general questions about reopening, we recognize that we have limited time in this town hall and apologize for not being able to answer all questions tonight. We will keep a record of questions asked, and we will reply to the sender. We will also post those questions to our question and answer section in our reopening web page as well. Thank you for your attendance, and we're excited to share information that we have for you and your family tonight regarding the reopening of our school district for the students of LeGrande. So I'm going to go ahead and start moving, and I am going to take over the screen. And hopefully everybody can see the screen that I have. So we're on the reopening, and we're going to just start going forward. Our agenda for the meeting today is to share our responses to planning that we've done through the last 4 or 5 months of our school year. Talk about the reopening of our school district, review ODE guidance that we've had to utilize in our planning and make adjustments, discuss our instructional models, share safety support that we have for students and staff, the final preparations that we have for our school year, as well as the questions and answers that we've received. We'll be going into those. And then we'll talk a little bit about the next steps for getting family preferences for their specific instructional model and services. One of the things that I think it's important for everybody to know is when we started our fall planning, it was really in late May where we were starting to get organized. And then it was early June when we started our first planning meeting. And we had over 40 people on our planning teams. We had parents, we had staff members, we had custodians, we had cooks, we had our bus garage, we had teachers, administrators, folks from public health, folks from Grande Hospital, county commissioners were also invited, and folks from EOU. So we were looking to be inclusive in our process for gathering feedback as well as development of our blueprints. we knew that there would be at times, you know, a lack of agreement in our process, even a feeling of a lack of time in how we organized. And we felt that decisions would be scrutinized over time and that there would likely be shifting circumstances as we made our plans to reopen. So we did go into this process with our eyes wide open. One of the things that I also want you to be aware of is that in this time, we deeply feel that we're here to serve our community. I won't read to you everything that we have in this slide, but just it's one of those that whether you're afraid or whether you're courageous, we're here to support you. Whether you feel that your students are skilled in sports or athletics or arts or not skilled, we're here to help those children. Whether folks are happy or sad, we're here for them. And whether folks are good at solving math problems or reading books or answering facts, or they're not, we're here for them. So it's important for you to know that we want to attend to your children and support our community. One of the things that for me has been important, and I hope that you think about this in your home life with your families, is that for students and staff and our community and our parents to be resilient, we do need to have supportive family, social relationships. People do need to exercise, get adequate sleep. Folks need to have proper nutrition and spend time in nature, listening to music and meditation. So I'm hopeful that folks take the time to do that. And if we stay in this positive psychology place, if we're in a mindset of gratitude, of hope and optimism, of forgiveness, and also building positive relationships, we're in a much better brain state for us. And for me, one of the key things that I know I share with our staff over and over again is we're better together, and we need to stay as together as possible. I believe if our community stays together and supports one another, LeGrande will get through this amazingly, but we need to stay with each other and support each other as best we can. One of the things you need to know that in the development of our plans, it was really important that we grounded ourselves with a set of beliefs and values for how we were developing our blueprints and our reopening guidelines. So we wanted to put a lot of time into our safety precautions. We believe that schools also play a major role in the economic and workforce vitality of our community. We believe that students deserve a high quality education, no matter their environment and no matter the modality, whether it's on-site or online. We wanted to do a quality job of supporting students. We do believe that parents and adults they're the fundamental people that support student success. So making sure that we're working well with parents and staff members to meet the needs of children is important to us. We wanted to make sure that we have positive relationships with our students as well as our staff and as with our school families and community during this time. It's important that you understand our systems and how we plan to operate. And we also believe that following our strategic plan and keeping that as our North Star was important to us in the ways that we developed our plans for supporting students and staff. For me, as a superintendent, I feel like I want you to just know some of my values. I do believe that schools are fundamental systems that help to develop academic knowledge, skills, social, emotional regulation, good citizenship, and positive contributions for society. Schools are necessary for society. I believe that. The impact of closing schools, I believe, has many second order, third order consequences to students, families, and our community, our economy, and our future. So know that we've done a lot of thinking about that, and we do believe that it's very important for the safety of our students to also have them in school. That's a high priority to me and to many others. Not having students in our school buildings has been extremely difficult for our families, for our children, for our educators as well. And our district must address safety concerns for students, staff, and families just as importantly as the social, emotional, and cognitive factors referenced above. So this slide should hopefully ground you in a beginning and an end of the things that we need to do. Do know that we're going to be sharing this slide in our website and also in our social media website so that you understand a lot of the steps that we still have to take in August and things that we need to do to make sure that we support students and get the necessary materials and logistical information to our parents and our students and our staff as well. Do know that in the development of our instructional plans, we had to review and implement quite a bit of state guidance. Do know that we follow executive orders. From the inception to now, we've had different executive orders that the governor has given us. We've had now 3 versions or models of the Ready Schools Safe Learners guidance that we have to continually take into consideration. So there's been instances of planning and replanning, communication with one another, just to make sure that we're on the same page with the instructional models that we're doing, and also following all the safety parameters. When we first started this process, late May, early June, we did take the time to give a feedback survey to our families. I think it's important for you to know that in that survey, those that responded, most families felt that we did an okay to great job in terms of distance learning. I'm going to be the first to tell you it's not ideal to do distance learning. I definitely prefer in-person learning over distance learning. There's a lot of ways for us to have gaps, but I was very pleased with our school district and the way that we managed, organized, and operated and supported each other and supported students. And do know that distance learning then is not the same as comprehensive distance learning now. So what was then is different than what will be in our future. Folks indicated to us that in terms of communication, 95% of families that responded indicated that they felt that our teachers communicated well. Those that were interested in physically reopen, 87% of respondents indicated that they would like to see our schools open on-site in person. When asked about having safety requirements met, social distancing, face mask, following hygiene, sanitation protocols, 92% of our families indicated that they were fine with us doing those kinds of things to safely reopen. As it relates to the safety sanitation procedures, health screenings, 77% of families understood or were okay with health screenings. Social distancing for staff and peers, 59% indicated they were comfortable with that. Not having or limited access to volunteers coming into our schools, 67% of families indicated they were comfortable with that. Face masks, 50% of families interested, they did not really want face masks, or they were for face masks. So routine disinfection of our classroom surfaces, 94% of families indicated they were good with us doing that routinely. And then also regular required hand washing, 97% of families indicated that they were interested in making sure that we do a lot of hand washing. As it relates to our our planning and the process that took place, we arrived at a time where we really wanted to do stable cohorts, which again indicates that students are with their group every day and they're together as much as possible. So there's very little mixing of students. They're not going to other zones. They're staying in zones. They're staying in regulated spaces. They're with the teacher for most of their day. They have assigned locations that they're at. It's very restrictive. And for us, our staff that were on our planning team definitely felt that we wanted to give students the most access, the most opportunity, the most consistent educational experience. And so we wanted to move forward, and we did plan to move forward, and we still do plan to move forward with a stable cohort model, as we believe that is the best that we can give our students and our community as well. So just remember that's important for you to know, that we're planning, when we come back, we're planning to do a stable cohort. And that means that it's based on square feet. It means that students are together. K through 6 are together all day. Currently, 7th grade through 12th grade will have the opportunity to be in 2 cohorts, a morning cohort and an afternoon cohort once they're on site. These cohort sizes are never going to be larger than 25. It's really based on the square feet parameter of the classroom. Students will not be mixing with one another. They're going to have assigned locations and assigned teachers to them. And I'll get into more details, but I really just want people to understand, what does a stable cohort mean? And I also want folks to understand that a stable cohort allows us to bring students back 35 hours a week, about 7 hours a day. We're really going to have some changes in our schedules, but just know it gave us the most time the most opportunity to serve all of our students. And that's what our planning teams, our design teams plan to do. I made it clear, I feel I made it clear on June 18th that we were planning to return to school. We indicated that we were going to have a full return to school based on square feet parameters and spacing requirements. We kept moving forward with that message. We sent that to the newspaper. We put it in our newsletter. We put it in our webpage. We put it in our social media. In retrospect, I feel like I could have done better by doing a robocall and making it clear that way. But I felt in many other print ways that we made it clear that we were planning to come back to school with a square foot cohort model. And what happens in June versus what happens in August isn't always the same. So just know that I indicated earlier that the Ready Schools Safe Learners Guidance is now in its third iteration. There'll be a fourth iteration coming out next week, I believe on August 12th. And so with all these updates that take place, it really requires some adjustments. And so we knew in late June, June 30th, I believe, we knew with this slide right here that the state really wanted us to start doing more with short-term distance learning. And it became important for us to make sure that we started to align our online cohort model to support short-term distance learning. Also in that time period, we received a slide and we received a presentation that indicated that schools really needed to start getting ready to understand how to do comprehensive distance learning. And these types of slides started to come out about outbreaks, and if we had to do short-term or long-term, that schools needed to make sure that their on-site model was able to sustain and support long-term and short-term. So the shift really became to is our on-site system going to easily flow with the comprehensive distance learning system? So in mid-July, we started to bring back some of our educators to help us plan our on-site model and make sure that it was in alignment to comprehensive distance learning. So we started to do more with technology and ensuring that we had the technology and the resources available to implement comprehensive distance learning. July 20, really, I think it's July 22nd when we received the newest update. No, it was actually supposed to come July 22nd, but it actually came July 24th when we received our next update for Ready School Safe Learners. And in that update, the state started getting really clear on cohorting parameters, and they started to indicate that in reality, and that they really wanted to see smaller cohorts, and that students should not mix with more than 100 students in a total week. So it created a lot of need for making sure that students were not being out at recess together in large groups or out at lunchtime together in large groups, also making it clear to folks that we couldn't have, a 4-period day where you had 20 kids or 25 kids in a classroom and then mixing with another 25 kids in a classroom and then another 25 kids, because at the end of the day, once you get to 100, it's too hard to contact trace. So a lot of parameters started to come into our planning as well. And that's what we had to make adjustments for. Another thing that came in that July 24th iteration of Ready School Safe Learners was face coverings. The reason I'm saying a lot of these things is I really want to make it clear to our public that we're going to follow state guidelines. We're going to follow Ready School Safe Learner guidelines. We're going to follow Oregon Health Authority guidelines. It's indicated that we have to do face coverings for kindergarten through high school. It's indicated that we have to do face coverings for all staff. So whether that's face masks or face shields, it's important for everybody to know that if they're going to come on site, onto school, or ride our buses, they have to have either a face mask or a face shield at all times. So it's very important that people know that that's part of the condition of coming back to school on site. Another slide that was important for families to know is that no disability category would universally be prescribed to having to wear a face mask or a face covering or a face shield. So it's important to know that if we do have students that have certain disabilities and they ask for an accommodation, we're required to give those types of accommodations. So again, making it very clear that that's part of the process, but definitely there'd have to be a team meeting, a discussion with staff, a discussion with our school nurses. And of course, if folks don't really want to wear face shields, face masks, then we're happy to offer online education for families, for students that really do not want to wear a face shield or a face mask. Want you to know that in that time frame also, we've been working on our reopening plan. We've been creating numerous iterations of it to really explain to our community, to our parents, to our staff, to our students how we were going to operate. It's important that you look at our website now that it's open and you review our reopening plan. It does have kind of a beginning, middle, and end of how we're doing things, from the instructional to the safety to the operations to the day-to-day. My hope is that you get to use that plan and you review it carefully, and then you ask us questions if you have questions, but that it is used as a source of understanding for how our district will operate. We have also updated our communicable disease plan, and that is the plan that we have to follow in the event of any sickness or outbreak. So just making sure that we have that available to you all, and it's completely updated and ready to go. So moving on, and again, right before the health metrics, we were ready and prepared to have an in-person model, K through 12, stable cohort, class together all day. No major student transitions, specifically in terms of K through 6. All of this for better contact tracing. 7th grade to 12th grade, we're still going to have some level of a half day, morning period and an afternoon period where they would try to have students potentially in a different cohort with a different teacher so that they would get to have more live instruction. We were happy with that. I believe our county officials were happy with that. Our health department was happy with that. We were looking to make sure students get an opportunity to work with each other, be on site, have their needs met with counseling, needs met with food, needs met with staff, support in the classroom. To us, it's very important to be able to offer that. We were also, we've had LeGrand Learning Academy. This is the 4th year of LeGrand Learning Academy for our school district. So if folks weren't aware, we've had an online academy, K through 12 now for 3 years. We're starting our 4th. And we're going to make it a little bit more clear in a second about all the things that we do in that learning model. And then we also knew that we had developed a short-term, long-term distance learning plan. And it was based on the fundamentals already of comprehensive distance learning, because we knew what we were receiving from the state was that we needed to prepare a short-term and long-term distance plan. And we already had it based on a Google platform with synchronous and asynchronous learning, with lots of lessons and activities that would be loaded. So we knew we were doing these kinds of things. And we'll have Scott Carpenter speak a little bit more to our comprehensive distance learning. This kind of changed the world for LeGrand School District once we received this guidance. I knew we were going to be receiving some level of health metrics guidance, but I really felt that it was more of a guidance towards what we would do in the event of an outbreak and how many cases you should have before you shut down schools, or you shut down a classroom, or you shut down a district. So I felt like it was going to be more about that versus implementing comprehensive distance learning and having more of a state and county plan. So I want to just be clear, it did come to me as a little bit of a surprise on how restrictive it was going to be. And I'll do a little more explaining about the health metrics. One of the things you need to know once this came out is that our county metrics here, if people can see what I'm circling, has 10 or fewer cases per 100,000 people. Well, Union County is about 27,000 people. So what that means is that if we're about 27% of 100,000, and 10% of 27% is really 2.7. If we have more than 2.7 cases, which is really 3 cases in a week, we are not meeting the county health metrics at this time. And if we also have positive tests of of higher than 5% over 7 days, then that's really one positive test out of 20 tests. We're not meeting the county metrics. So it was really a very restrictive plan that made it very hard for school districts to say we're meeting these requirements. And the statewide metrics also has a requirement of having less than 5% in order for schools to operate fully in a K-12 model. So it's kind of designed to slowly get schools into in-person and then potentially a full in-person. And it's also designed to be really looking at the health data as it relates to COVID cases in our community or in our county, and also the percentage of positive tests. So it's a very important process that we need to follow. I'll later have our health officials talk to it. In order for our school district to get into at least K-3, even if we're not meeting state requirements, if our school district has fewer than 30 cases out of 100,000, so really again, back to that 27,000, 10% is 2.7, 30 cases is really about 8 cases. If we have less than 8 cases a week, we can come back to a K-3 model that also has students that are in special needs to be able to come back. So we haven't met that we haven't been able to meet the in-person or the 10 or fewer cases to even get to a K-3 model yet. And that's again important for you to know as a reason why we didn't start our school year in person. We have not met the metrics requirements to be able to start in person at this time. We will have to meet those requirements 3 weeks in a row of 3 cases or less to be able just to get to a K-3 limited special programs population back as well. So just know that. I'll move on. I want you to know about just how I believe things are happening, and it's just important for us to have the big picture. As you can see, this is the cases that are taking place in the state of Oregon. This is from the Oregon Health Authority. This is as of July 29. Once Oregon started to reopen, we just had quite a bit of cases started to happen in June and July. And as we become more restrictive in our state with wearing face masks or face coverings, social distancing, and other requirements for phase, whether people are at baseline or phase 1 or phase 2, the number of cases have been coming down. So my hope in telling you that is that it's looking like we are starting to flatten the curve all over again. And the more that we do that, the likelihood that we can have in person all students soon, because the state requirement is less than 5% positivity rate. And what I've been told several times is that even up through late May, we were always below a 5% positivity rate. So as soon as we get low enough, we'll likely hit that state requirement again. And then we just meet the county requirements and we'll be able to get kids in our buildings. So my hope is that this slide gives you some hope. In our own community, the thing that I want you to know again is once that metrics came in, I indicated earlier that we can't really have over 3 cases over a 7-day period. And as you can see, even on August 4th, we had 4 new cases. These are the kind of slides that I'm able to get through JB Brock. And you can just see that currently we're not meeting county health requirements for Union County, for LeGrande. So again, it's holding us back from being able to offer any in-person learning at this time, unless the metrics changes. And there's definitely work taking place to try to get the metrics to change for rural counties, rural areas. Again, I'm just trying to make it clear as of the end of that July 26 week, we were above the case rate for Union County, but we were below the positive test rate, just barely below the positive test rate for Union County. So again, that shows you that last week was not a good week for us with the number of cases and positive rates, although we're still below the state on the 4.8%. This right here is a slide that we'll have out there, and we'll look to put it on our web page more often, and it'll kind of give a 3-week indicator of what's going on. And again, this was based on Union County. JB Brock again helped to organize and create this document or this slide for us based on Excel data. We've been able to make it a little bit more clear based on the parameters that we have for transitions. So again, if we want to do in person, we have got to have less than 3 cases 3 weeks in a row, and the state has to get to below 5% so that we can, and it has to happen 3 weeks in a row. And at that point, we can start to have in-person K through 12. If we want to have limited, we're still at we have to have less than 3 cases 3 weeks in a row, and then we can get into limited. And then again, then it gets into if we have over 8 cases, we need to start getting ready to get into comprehensive distance learning. If you have even 5 cases once you're here, and you have that 2 weeks in a row, and these are the parameters in here, and you have that 2 weeks in a row, we have to get into comprehensive distance learning. So it's taken me quite some time to really try to understand our metrics and how it works. Again, it was new information to our school district, but we have to follow those guidelines and meet metrics requirements. So for our community, for our staff members that are here, for our stakeholders, at this time we're forced by the health metrics to begin the year in comprehensive distance learning at this time. The existing metrics as it's written right now has removed our ability to offer stable cohort in-person learning at this time, starting August 31st, like we originally intended. If it was up to me, I want to make it clear, if it was up to me, I would have liked to have started us in our stable cohort classrooms. And I do believe that that's, I've given many reasons. That's the best that we can give to our children, the most consistent education we can give to our children, the most equitable experience that we can give to our children. And I do believe if we keep them in a stable cohort all day together, if there was a spread or if there was an event, we could, secure that cohort and keep moving forward as an organization. So that's important for you to know. But that decision it's not fully up to me. There's a lot of requirements that we have to follow. The safety of our students and staff at all times remains our highest priority. Our fundamental decisions need to be grounded in the care and safety of our students, staff, and community. From a leadership and organizational standpoint, I needed to move us into comprehensive distance learning and make it clear so that families our school district would have some sense of stability also for how we were starting. There was a lot of, we're not sure what the plan is, or we're not sure if we're in person or not in person. By making it clear that we're in comprehensive distance learning, it allows families to be able to meet their needs for childcare and to understand what's going to be taking place. And it allows our school district to get really good and really strong at implementing comprehensive distance learning for our students and in support of our staff. And again, I just want to make it clear, based on the spread of COVID in our community, we are not able to start at this time, but we're looking to find out when it's allowable. And our hope is that October 5th, we'll have met that requirement for 3 weeks to be able to offer, at least for K through 3 and special program students, as well as CTE students, in limited group sizes, in-person education. Our goal is to make sure that can happen by October 5th, but it really just depends on the health metrics and how things are working out with that. One of the things I just want you to know that we're doing on our end is that we've been working and communicating with state. We have County Commissioner Andreas as part of a committee that gets to talk about the metrics and is working on a work group that's trying to get our state to change the health metrics requirements. And one of the things that I know we're advocating for is the potential of bringing back K through 6 students versus just K through 3 students. And even if we can get back K through 5 students, that's a win versus a K through 3 model for us. And we're also looking for an increase in the metrics threshold as it relates to the density of population that we have in rural areas versus metro areas. One of the things I guess I would want you to know is that Union, Baker, Grant, Harney, Lake, Malheur, and Wallowa counties combined have a population of 105,000 people and a square mile radius of 40,940 square miles, which is about 40.6% of the state in terms of square miles. Our density is about 2.6 people per square mile. And then when you count all the other sides of the state, which is 57,526 square miles, their population is combined 4,194,360. Their density population is 72.9 people or 73 people per square mile. So we're not built the same. We're not the same, and we're trying to make it clear to our state that the rural areas should have different threshold for population density as compared to a metro area. So we're asking for a percentage increase in the number of cases and a percentage increase in terms of positive rates. So we're just making it clear to our state that we hope that they can change the metrics and make it so that we can have more students in our schools sooner versus later. And I wanted to make that clear. I also want to make it clear that we are, at this time, we are not having childcare for essential workers. We're not having childcare for anyone at this time except our own staff. We are doing this because we really want to have our employees on site, working at their computers, working in their classrooms, working and having technology and resources available to them to meet the needs of students in comprehensive distance learning, and hopefully in the future, in the near future, with in-person learning. So we're asking our staff to come back. We're asking our staff to do the best that they can to meet the needs of students. So we're going to have childcare for them, for those that have kindergarten through 7th grade students. And that alone will likely take 7 to 10 of our parapros to offer childcare for our own staff. I am indicating here that if you can find a childcare agency that wants to can support your child care needs, but they have technology needs, so with tech devices or Wi-Fi, we'll work with them to make sure that they have the necessary technology so that they can work with children at that location. And also, if there is a workspace that an employer has and they go through an approved childcare process to support their employees with childcare, we'll also work with them to provide technology and resources to assist children learn in those locations. So I think it's important for you to know that we're going to try to do what we can to support families, but I apologize that at this time we're not offering childcare except for our own employees, our own district employees. I wanted to give this slide again. This slide is going to go out to everyone. For our folks that are our families that are still looking for childcare, you can contact 211 for childcare referrals. Talk about your needs, get support for qualified childcare providers in our community, see if they can support your family, support your child, and then if they need help with our technology, we'll be happy to work with them. They just need to reach out to us and we'll do what we can to support. And this is my last slide, and then it's going to go to Scott Carpenter. And I just want you again to know that just that it's important. We've had different pandemics in our time, in our nation and in our world, whether 1869 or whether 1919 Spanish flu pandemic, which I understand killed about 50 million people in our world. That we're gonna go through this. We're gonna be better at being with each other, having better relationships with each other, understanding how to implement and utilize technology for student learning better. But we're also going to be more attuned to one another and the needs of one another. And I look forward for us to getting on the other side of this pandemic. But I will tell you, there will be a time where we will not be in this situation. I firmly believe that. And I'm thinking that this is not going to be the best year or the most consistent year, but I also think we're going to make the best of it, and that we're going to be better for it in the future. So I'll stop there and we'll leave it to Scott.
Thank you, Superintendent, and welcome to all of our families and stakeholders. The number one question we've been asked over the last couple weeks, if not months, has been, how is this different than distance learning in the spring? And I can assure you that it is wildly different than distance learning. What we experienced in March and April as we planned then were plans hurriedly sent out to us from OD and others, talking about grades and minimizing the impact of grades, giving seniors the ability to sort of leave early and meet graduation requirements early, to minimize the stress and strain on students who lacked resources, on flexibility in terms of what minimum restrictions or minimum curriculum we could produce to be able to support families but still learn. There was discussions about should it be a supplemental period or should it be new learning, and that changed dramatically overnight before April 1st. So that period was a time to get organized, a time to respond to an emergency that no one had experienced before. Now we're in a totally different phase where we've had months to plan. We've gone through the spring and distance learning, and now we know to a larger extent what has worked and what has failed, and how can we provide a high quality distance education for our students. And that's what we're going to share with you today. So this slide just emphasizes for me the partnership that exists between the school district and our parents and our students. Generally speaking, as schools, we exist from about 7:30 or 8 o'clock until 2 to 3 to even 7 o'clock at night for some families, as we provide athletics and full-time education, clubs and activities. We've taken a large portion of the burden with regards to education and in partnership with parents, and recognize that during this time we're going to be shifting some of that burden to parents and caregivers and working to respond to your needs. I hope that you hear that loud and clear as we plan, that we really want to partner with parents, and if there are things that are working or not working with your child, that we provide options for you so that you don't feel stuck in one mode or one option, that you can move forward and help your student to learn, and that we're a partner with you in doing that. So this is our comprehensive distance learning option for K through 6. It's a home-based digital option for our families. Its primary platform is through Google Platform. All the other connected learning apps and software, whether that's Explain Everything, Raz Kids, Waterford, iReady, will be loaded through Clever. I've talked with Casey Hampton, who's our IT director, and when a student logs in this fall, instead of having to do multiple clicks or searches to get to their account or to get to Google Classroom, it will auto-direct them straight to Clever, where they can access their Google Classroom and learning tools. We're excited for that because sometimes kids get lost in the shuffle or in the path towards where they need to access education. So we're trying to put that front and center as they use either their own Chromebook or their district issued Chromebook. We're going to be utilizing Zoom and Google Meet to have synchronous learning. One of the things you'll find as you read if you have a chance to read or look at the comprehensive distance learning guidance that has come out from the state, is that there's a big emphasis on synchronous learning, that sometimes, and I would say most of the time, kids learn best when they're interacting with their peers and when they're interacting with a teacher. So we have built our schedule this year to make sure that we make the most of teacher-student interactions. We recognize that this, to some degree, comes as a burden on parents and families, that you may now have a student that from 8 to noon or from 9:30 to 2, as we'll talk in other meetings, that you have children in that synchronous learning schedule, and that sort of might restrict your schedule as a family. If that is restrictive, you have the option every day to participate in that synchronous learning or to not participate in that synchronous learning. And the important learning that happens that day will be captured in video vignettes, 5 to 10 minutes long per subject if you're in K through 6th grade, and load it into the teacher's Google Classroom so that you can access it asynchronously, either in the afternoon or the evening when it's better for your family. Those will happen daily, Monday, Tuesday, Thursday, Friday, and we're using Wednesday as an intervention day, so students can plan to have no new instruction on Wednesday, but then we'll be doing outreach, interventions. If students are struggling with content, the teachers will be available to be able to help meet those learning needs. We will be willing, or we are able to provide the technology. One of the questions that we've had is, are we only going to get one Chromebook per family? In this mode, because of the synchronous learning, we're looking at providing or making sure that every student has a Chromebook or technology. We want to make sure everyone can access those things that they need to. In the K-6 world, we're going to have morning meetings so that we can meet the social emotional needs and build community. We're going to focus on reading, math, science and social studies, and give them their specials, whether that's PE, music, and library. We want you to know an essential difference between the old distance learning to the new comprehensive distance learning is that interventions are woven in to the school day or that synchronous learning. So your student is likely to experience core content for a short burst, 20 minutes, and then through Zoom, automatically dispersed into breakout rooms with 3 to 5 of their peers that are at their same level as identified by different diagnostics that we have, and able to work with the right specialist on the right skill for their ability group. So we're going to be able to provide the right mix of core content to all students, and then also intervention so that we meet learners where they are. It's not a packet system. At grades 7 and 8, we're going to be meeting from 9:30 to 2, and I want to focus on that first. Some parents might ask, well, why are you doing 8 to noon for these elementary kids, and why are you doing 9:30 to 2 for secondary? We have found that synchronous learning is very essential for primary age children. As you get further into secondary, where kids are getting older, they can easily learn the content on their own in some cases. And now that's child to child. But by doing this 9:30 to 2 schedule, it means 2 synchronous classes before lunch and 2 synchronous classes after. And truth be told, from my years in secondary, most secondary students tend to wake up a little bit later. They like to stay up a little bit late, and we're providing some flexibility because of that needs. Research says that school, one research study said that school should authentically start at 10 o'clock for teenagers because of just their body and the need for sleep. But what this does is it allows 2 classes before and 2 classes after, so that if a student wants the option of having all their classes in the morning, they could take 2 classes asynchronously in the morning, or they could do 2 classes asynchronously in the afternoon, or they could take all classes asynchronously in the evening if they're a senior or junior and have a job. So by having this schedule, we provide the most options for a family schedule and for a student's schedule to be successful. We also recognize that doing all 7 classes in one day is a little bit ridiculous. To do that daily schedule means that we would instruct for about 45 minutes. You'd sit in class for 8 hours on a screen, and then you would do your homework and then do it all over again the next day. In this schedule, we're going to focus on no more than 4 periods a day. So we're calling it the AB block schedule. On Monday, your student will experience periods 1 through 4. They'll be able to focus on those classes. They won't see those classes again until Thursday of that week. On Tuesday, they'll get their B schedule. So that would be periods 5 through 8, or at the high school 5 through 7. And then they don't see those classes again. They have time to work and do until Friday. That Wednesday intervention day is maintained so that we can do outreach, answer questions before things become due or new information is taught on Thursday and Friday. So we really want to support, we want to push learners. We want to provide them good instruction synchronously or asynchronously but we're going to push and give ample opportunity for students to ask lots of questions so that they can be successful later in the week. As far as a distance education model at the high school, you can see that the schedule is relatively the same. We wanted all secondary to be the same. You have diminishing returns the more schedules that you produce. And so hopefully you see on here that if you have an elementary kid or an elementary family, that you're going to have a pretty simple schedule, 8 to noon, or asynchronous later on. If you're secondary, that you can plan on a given schedule or routine. And students, based on how things are going, can mix and match the synchronous or asynchronous options that are available every week. Just because you chose synchronous on Monday doesn't mean that you have to be synchronous on Tuesday. We recognize that life happens, and certainly that during COVID, that your family may have certain needs during that time. It may be impossible to access synchronously on that Thursday or Friday. And so every day you get to choose which one that you want to focus on. We are going to have part of the reason for the schedule, and sorry, is that we're going to have 4 hours with teachers being in front synchronously with students, but we're putting a high priority on collaboration and collegiality during this time. It is essential for our teachers' success and for your students' success that they have a lot of time to meet the requirements of comprehensive distance learning in providing office hours. So there'll be a scheduled hour for anyone to be able to ask questions. And for especially at the K-6 level and even into departments at the high school and in the middle school, for teachers to be on the same page. Part of what's going to be required at a comprehensive distance learning is for them to transition a lot of the work they've done over the last number of years in the classroom to be successful online. And so we're providing time every day to be able to meet those needs, K-12.
Okay, I'm gonna go ahead and apologize that we didn't have our health officials talk about the metrics. So at this time, I'm going to go ahead and ask Dr. Zach or JB or Carrie to share any thoughts that you have about the new state metrics.
Hello, everyone. This is Dr. Zach. I wanted to share my thoughts that we are uniquely situated here in rural Eastern Oregon. A lot of counties simply do not have the opportunity that we have across the country to potentially even consider in-person opening of really any kind in the fall semester of this school year. So based on how we've been doing the outbreak, we have a really unique opportunity. What I want to share with our community is that in order to keep kids in school, which is one of my goals as a pediatrician, it relies on all of us still doing our best. Quarantine fatigue is a real thing, and we've all experienced that. I know I have personally, and I'm sure that I'm not alone in that. But what I do want to emphasize is that as we continue through these months, continued diligence in our social distancing, as well as in our mask wearing, will help us be successful so that we can get your kids and my patients back to school to get them the education that they deserve. We're working with state level leadership, as Superintendent Mendoza mentioned, to try and figure out, is there a better way that we can understand our metrics and numbers in a rural area? And that will be ongoing. What I tell families when I meet with them in the clinic is I fully expect change. And I would tell you to expect change, roll with the punches, but we're going to get through this together and keep on keeping on.
Thank you.
Hi, this is Carrie, Public Health Administrator, and I actually I've been writing notes through this whole presentation, and Dr. Zach pretty much expressed most of the things that I wanted to talk about. I really appreciated Superintendent Mendoza's focus on hope, really thinking about the positive things that are going to come out of this. And, I think at this point, we really, it benefits us to focus on the things that are positive and really focus on hope, and also focus on the things we have control over. And as Dr. Zach shared, we really do have the ability to change what happens in our community by following the guidance that we have before us. we don't have a reliable treatment, nor do we have a vaccine for COVID-19, but we know enough at this point in time, even though we're still learning about the virus, that there are steps we can take to slow its spread. And I think that we all as a community have demonstrated that we can do that. And I think that the continued vigilance is critical. But we can get to the point where our students can meet the metrics that are set by our state leadership. And we can get to that point by taking all of these steps that we know will help. Staying home if we're symptomatic, engaging in the practices that we've talked about, like wearing the face coverings, hand hygiene, 6 feet of physical distancing between each other. And I know that so much of this will continue to be out of our control. Things will change. I can guarantee that. That's the one thing I'm certain about at this point in time. But I know that our students and the people that take care of them in schools and teach them in schools and have always had their best interests and safety at heart can be flexible and can be adaptable, and that we can rise to this unique challenge and this unique situation and support our community through this time.
I think the one thing I would just hit on is that, just to emphasize one of the points that Dr. Zach made, and that's that, we do continue to advocate, the commissioners continue to advocate for the community and really point out to the state how we are unique. And to date, our community has been very successful at flattening the curve, and we think we can continue to be successful. One of the unique things we have about our community is we work very, very well together and work very closely together. And I think as we worked through our initial outbreak, which was pretty significant and was, even national news for a while, the community worked together and we were able to flatten that curve. And we did maintain our hospital capacity, and really we were able to show the state that we were successful, that we did come off the watch list. And I think as we continue to talk to the state about what makes sense for Union County and the rural communities, we will continue to advocate on our behalf, and really, our goal is to get our kids back in school, get our kids back in-person school, because as we've all heard, it is important, and it's important for a number of reasons. But, as a parent, I think I can say it's certainly a priority for me.
On that note, JB, Carrie, and Dr. Zach, do you have any thoughts that you want to share on our cohort model and how we've been planning around that? You've been a part of those discussions. Is there anything that you would want the public to know about stable cohorts, and how we're moving forward with our district with our in-person instructional plan for the future?
Well, I think since we started, the conversations that I've had with the school district and Carrie has had the same conversations, it's about mitigations. It's about what mitigations can we put in place to keep our kids safe and really to keep our community safe. And I think the plans and the mitigations that are in place are designed to be successful, and I think they can be successful, and I think they will be successful. I think that the school district has taken, some creative approaches that I appreciate. I think that's what this type of an emergency looks for, is those outside the box creative things that, we wouldn't normally think about in our day-to-day, but, we've all heard the new reality. And I think I really appreciate how much that's been embraced, that, just because it's different and it's not the way we normally do business doesn't mean that we don't explore those options. And I'll be honest, we've explored some options that have failed, but they were worth exploring. And I think we will continue to do that to try and ultimately get our kids back. And even if we don't get our kids back in school, just to provide the best educational support we can.
Thank you.
Thank you. Yes, I'd like to add that as we learn more about this virus, what we know is that kids who are 0 to 10 seem to transmit this differently than kids who are 10 and up. I will be the first person to tell you that we do not know everything about this virus. And I want to point out that our logic in closing the schools in March is actually very different from our logic as we approach this reopening process. In March, we anticipated that this would behave a lot like seasonal influenza virus. And for that particular virus, kids are the main source that then spread it outward to the community. That was what we were really worried about. Based on the research that, yes, is limited, but what is available is COVID does not seem to behave that way. I can't tell you why. I can simply tell you that's what the research seems to indicate right now. As I said earlier, with things and change, I expect the research to change, and I expect us to learn more as we go forward with school opening. Right now, what the cohort models enable us to do is to stratify and mitigate our risk. 10 and under, and in some studies even 12 and under, seem to be a lower risk category, so they have a more permissive cohorting model. Above that, slightly higher risk, so a less permissive cohorting model. This is based on the best data that we have right now and is definitely a reasonable strategy going forward.
Thank you. Carrie, is there any thoughts that you want to share?
Yeah, I just want to add that, the cohorting, again, really just allows us to have students be in school and, slow and contain the spread of the virus among the school community as much as possible. From a public health perspective, it also allows us to really quickly do the investigation and contact tracing. That's the key to our strategy and how we manage the spread of COVID-19 in our communities. So, when we have these cohort groups, the idea for public health is that it allows us to quickly do the investigation and then contact trace, and again, minimize the number of students and staff in the school district that need to be isolating or quarantining. And so again, the cohorts just really allow us to basically keep the students in school and them learning, which is exactly what we all want.
Thank you. Scott, let's have you wrap up our LeGrande Virtual Learning Academy, and then we'll go into Landon, and our Director of Student Services, Landon Braden, will be next after our Director of Education Program, Scott Carpenter, finishes this next slide.
Thanks, George. One of the best kept secrets in LeGrande School District is LeGrande Virtual Learning Academy, or LeGrande Learning Academy. It has operated for 4 years. We recognized years ago that we needed a learning academy that offered a full complement of online classes that would help the student to graduate. We have developed that, been developing it to make it more robust over the last 4 years. And we're excited to let you know about it. It seems like every day people are wondering what options we have. And one of the reasons this was a kept secret was our priority was to have kids in school working with teachers in our brick and mortar locations. We felt that that was their best strategy to be successful. There were always students, and will always be students, where that is not their best, most successful environment. And so we had this when that became apparent, but we didn't advertise it. We are a regional leader in online education. We did a lot of work this summer with the ESD to spread our model to the 18 districts in our region, so that now Intermountain Online reflects what LeGrande Learning Academy developed into over the last 4 years. We are excited to be a partner with other districts in making online a robust option. And our regional teachers of record, we draw from teachers all over the IMESD region to provide the most opportunities either in Google Classroom or in Acellus to our students, rather than being locked into simply what we can provide in our own district. Our program is different from Baker Webb Academy or others, where we have agreements where we don't steal or we don't take kids from other districts. We want to serve LeGrande students. We want our program to be responsive to LeGrande learners, and we do not want to harm the districts around us that serve their communities so well. And so we're excited to offer this program. It is a great option for families that are nervous about the possible transitions that may happen as we're able to offer in person, and then maybe those opportunities don't aren't able to continue because of the matrix, and now they're back into comprehensive distance learning. And so this provides a very stable program over the course of the year. One of the questions that I've had over and over again over the last couple of weeks is, can my kid move in and out of this program? We are going to staff our district based on the preferences of our families. So in the next week, you're going to get a survey the superintendent will talk a little bit about later. We make these transitions at quarter or semester marks. And so if you're thinking about LeGrand Learning Academy, realize that you're choosing that as a longer term option. That you think that you want your kid to have this stable educational experience over the next few weeks or next few months rather than just a few weeks or the first month of the school year. We are working with educators in our county to provide peer-to-peer, virtual or in-person small activities, and in addition to the curriculum, and excited for just the expansion of this program to serve our community.
Now we're going to move on to our Director of Student Services, Landon Braden.
All right, thank you, Superintendent Mendoza and Scott. First, I want to start out by just saying thank you to the community and our community partners for putting in so many hours helping us plan and replan and then plan again. Without that collaboration, we wouldn't have been able to get to where we are. So in terms of accommodations, any student receiving student services on an IEP or a 504 will still be determined by an IEP team or a 504 team. It will still be a collaboration of the team to determine what that student needs to be successful in the current environment. One thing that we need to keep in mind is that, as was touched on by Superintendent Mendoza and Scott Carpenter, is that this environment, this comprehensive distance learning model is a quantum leap away from what happened in the spring. And so we need to understand that there will be attendance taken, assignments will be due on time. If there are accommodations or medical issues that are documented that a student needs extra time, of course, they will have access to that, but there will be a lot more accountability and a lot more structure to the instruction and the assignments that are handed out. There was a question earlier about technology. Each student in our district, as I believe Superintendent Mendoza had touched on, will receive a Chromebook. We also have roughly 100 Wi-Fi devices to help families in need that do not have access to dependable internet. So sports and other activities, we will employ and be allowable as soon as the Oregon Health Authority allows us to do so. And as I mentioned, students will have full access to services such as nursing, counseling, all accommodations that are listed in the IEPs and 504s, all interventions that have been received in the general education environment prior, they will have access to in our comprehensive distance learning model. Meals will be available during this time at the neighborhood schools. You can check those websites for times and availability of pickup for those meals. So when we talk about, I want to be very clear, whether we're in a comprehensive distance learning model, a hybrid, which is on-site, partially online, or our traditional delivery, any child that has an IEP or a 504 still has full access to their FAPE, full access to their free and appropriate public education. So if there are accommodations listed in their current IEP or 504, they will still have access to those things. The difference lies in really the structure of the instruction of the specially designed instruction. So as you can see in the comprehensive distance learning model, there will be a collaboration, a heavy collaboration between gen ed teachers and case managers to ensure that in the gen ed setting, in the comprehensive distance learning model, they will have access to specially designed instruction. They will also have access in special pull-out times where they will work one-on-one with a case manager or another staff to help shore up and reteach and make sure that they're on track with where they need to be. Again, the last bullet there on the comprehensive distance learning model, attendance and participation will be required. And of course, if your child is in the at-risk category or has a pre-existing condition, they will still have access to all of these things at home, even when we are able to come back when our county meets the new state metrics. Our counseling services are similar in that we have very dedicated and passionate counselors in our schools who have been working feverishly to design one-on-one services, access to social emotional resources. The overarching theme is still care and connection, building relationships. They will be reaching out. They will be screening new students as we look at new social pressures and anxieties that may exist to make sure that we are getting the appropriate resources to the appropriate kids. And as we step up into hybrid model, they will have access to those things in person. So the first group of kids to come back will be the K-12 or the K-3, excuse me, and then students with IEPs or 504s. At that time, they will have access to one-on-one instruction and in-person counseling sessions with their counselors. All right, thank you.
Okay, and I guess I'll come back to take over and go over a little bit of our extracurriculars. So just know we are going to likely have extracurricular and athletics in our school district. As it relates to sports, we do have to follow Oregon Health Authority and the guidelines that are set by the governor and OHA for that. OSAA is following the lead of Oregon Health Authority and our governor. We are likely going to have sports. It's just going to be different. We are extremely proud of our extracurricular and our athletic programs. If you did not know, our school district, our high school received the OSAA Cup. So we were by points ranked as the top high school program for the state of Oregon for all 4A schools. We have a lot of great student athletes. We have a lot of great artists. We have a lot of great actors as well. We do a great job in our community of helping our kids be well-rounded. And sports are a big deal to our community, and we want to make sure that you know that we're going to do all that we can to get sports to happen. And even if it's in a club setting, we're going to do that. Back to virtual clubs or virtual activities that we do, such, it could be chess club or robotics clubs. We might have to do them virtually, but we're still going to do them. The more that we can do things physically, we will be looking to do that. But just know there's other school clubs and other activities that we have. And if we have to, we'll start them and we'll do them virtually. Do know, though, that we have to follow OHA, CDC, Center for Disease Control, and OSA sanitation procedures for any equipment that we use at this time. And we also have to follow county and health metrics for who we compete with. Just yesterday, I'm sorry, we received the OSA calendar for our seasons. So just want to make sure that it's out there to our families, to our students. We are planning on having sports. And here it indicates kind of for swimming, wrestling, and basketball that in December 28th, we start to open in that time period for practicing for these sports. Then there's OSAA state competitions that start to take place at this time too for the end of the season. Practice starts to happen for cross country, volleyball, soccer, football. It makes me happy to see this, and I'm excited for that future. Things can change, as everybody's indicating, but I'm very hopeful that there is a plan that we can organize and use so that our students at the high school level can participate with sports. And our final season, which is really the spring season, practices start April 19th, and then again that competition will go all the way through June 27th. So here it also has cheerleading or dance, speech, solo, music, choir, band, orchestra. They still haven't given a defined season at this time, but just know that there are plans once we can have students in session to ensure we have OSAA approved sports. So very hopeful for that. just kind of now bringing it home. We're towards the end, and then we'll definitely get to questions and answers for everybody. Just want to make it clear that if you have to make these choices now. We're going to get to your preferences based on that survey. If you are, as Director Carpenter indicated, you want stability or you want consistency, you want to know that your child's going to stay home and be home, and it's going to be asynchronous, which is really not at the same time self-paced, doing it on, as you want to do when you're ready. This is Grande Virtual Learning Academy. We will still have check-ins with teachers. We'll have other things, but it's definitely asynchronous. It's not scheduled like our comprehensive distance learning model. And if you want to choose that, you may choose that, and we're going to support you, and we're going to do everything we can based on your needs to give you that. And that just means that you're not going to be coming into our schools. It really means that you're going to be staying home. Once we can even have students come into our schools and with the Grande Virtual Academy, we'll do that on a scheduled basis. When students need tutoring or need support or receive special programs or services, we'll do it that way. But just know you're likely telling us you're not going to be coming into our schools. And I'm just trying to make it, I know I'm being redundant at times, but I'm trying to make it that clear. You're choosing this program, and you really don't want to be in our schools. You want an asynchronous homeschool type experience, and we have that for you. We'll take care of you. We'll do everything we can to support you, but that's something you're going to have to choose pretty soon through that survey process. Next, I'm just really making it clear again what hybrid is for us. Hybrid, again, it's a combination. It's a combination of online and on-site. If you know for sure that you want to have your child on-site on our school grounds, that is a hybrid model, because there is going to be times where we have to do distance learning or comprehensive distance learning, depending on an outbreak, depending on a situation that takes place. Right now, we're not even allowed to have people on site. We have to open in a comprehensive distance learning plan. So it's just highly important that you realize if you want your child to be on site, you need to choose the hybrid model. And here it kind of gets into detail that based on the metrics, identified K-3 students and special program students, in addition to CTE students, can physically access our school site once we meet the first level of our county requirements. So here we're indicating special ed, 504, TAG, EL, title students, intervention students, CTE students. It's all going to be in a cohort model for those in that limited group. For K-3, it's going to be cohort. But for, again, if you're in the special programs, 4th grade on up, or title programs, 4th grade on up, or CTE, high school, or even middle school on up, those come in a limited number, which limited means 10, based on our guidance. So that's going to happen in the future, but just know one more time, I want to bring it home. If you are wanting to have anything on site, you have to choose the hybrid model. And based on the state and county metrics requirements, we'll be able to return more and more students to our schools. Again, if you want on-site and we're going to be doing work with our students up to K-12 someday, need you to choose that hybrid model. And just remember that we're going to have comprehensive distance learning take place as well as necessary. One thing I really wanted to hit on this slide is that because we want to do a good job with distance learning, because we also know that there'll be students that are on site and at times at home for short-term or long-term distance learning due to any kind of outbreak or any kind of condition, we are creating a modified schedule for on-site for our elementary schools. It likely needs to say K-5 right here, so I apologize, versus K-6. But they'll be on a modified schedule of 8 o'clock to 1 o'clock. And again, there'll be hours for staff to be able to support students that are doing asynchronous and synchronous learning in an online format, as well as planning and working with each other. In grades 7 through 12, their schedule on site will be 9:20 to 2:20. We needed to have different types of schedules because of busing and isolation and practices that we needed to have for social distance and cleaning and sanitizing. So it's really important that we needed to create this modified schedule. One, it helps the students that are doing online during any short-term or long-term break. But again, it helps us to clean the buses, sanitize the buses, and then really create bus schedules that only Central students only go to Central. Island City only goes to Island City. Greenwood to Greenwood. The middle school with the middle school. The high school with the high school. This is really good for contact tracing. I want to make it clear that if we do have to shut down a bus because of contact tracing reasons, that's what happens too. And that's where the student winds up going into that short-term to long-term comprehensive distance education just because of the quarantine restrictions that we have. So again, I'll say this in another redundant type way. If you choose on-site, it's hybrid, but just remember, if there might be a time when you're on-site and then an event transpires and we have to go to comprehensive distance learning. So you are accepting the fact that it won't always be smooth sailing. You are accepting the fact that there are going to be times where we might have to shut down the school and your student will have to learn from home in a comprehensive distance learning model. So I'm not trying to sugarcoat it. I'm trying to give you the truth of how it could work out. It won't be as consistent as you might like if we have events take place, but definitely making it clear, I prefer for my own children and I prefer for our future for us to have students on site as often as possible, as much as possible. So just know that. You just needed you to be aware again, if there's an outbreak that takes place, I've showed this slide before, and we have to go into a short-term distance learning, we're back into comprehensive learning. If there's something that happens to a child for the individual or the classroom or the school, that's part of the reason why we have to have these short-term, long-term distance learning, and they're in support of comprehensive distance learning. And that's why we have things taking place synchronously and asynchronously, because there could be a situation where just the individual child has to stay home, or there could be a situation where the whole classroom has to stay home, or the school or the district. And so that short-term, long-term is running almost simultaneously to any on-site model, because things could happen. And clearly, before we shut down the whole school district, we're going to look to shut down a cohort, and we're going to look to isolate and mitigate at that time. And then if there's more cases in the school, we'll again look to shut down cohorts, but there'll be a point where it becomes we need to shut down the classroom or shut down the school, or we have to shut down the district depending on the number of cases. So, and again, that'll be in consultation with our public health, and we'll follow a process for that. But just know, if you are choosing hybrid, you're choosing a lot of variable type situational factors that could run their course, and that's not certainty. So if you were looking for certainty, this model, the only thing that's certain is that things can change. If you were choosing the online virtual academy, the thing that's a little bit more certain is that you will have an online education and you will be at your home site learning there in an asynchronous fashion. I hope that I'm clear in explaining that. One of the things you just need to know is we can go into great detail, but if you read our reopening plan, we have everything down from the classroom to the meals to the busing. So just know we've written these in a way that reflects the key practices that we have to do for physical distancing, hand hygiene, cohorting, contact tracing. All of it is already inside of our handbook as well. And it's important to you that we use this as a key tool for our decision making in our operations. Want to make it clear as well on busing. It's really important for you to know that we're going to offer busing. Students have to wear face masks. Students are going to have hand sanitizers. We're going to encourage social distance. We're going to tell people all kinds of things before stay apart from each other. But I just want people to understand as well, or families to understand, that we don't get to control everything that happens before school, and we don't get to control everything that happens after school. And if you truly want your children to get to school without interacting with other students on a bus, even though we have masks, even though we have face shields, even though we're going to clean or sanitize hands, it's important that you understand that we'll transport, we'll do anything that's necessary, but my hope is that you understand that it's important to avoid busing if you can. You will, just because we're not going to be able to control what happens before they step onto the bus, and we're really not going to be able to control what happens after they get off the bus. So it's really a parent choice. It's a personal choice, but I'm wanting, again, to make it very clear to you, we're going to have busing, we're going to organize, we're going to do all those kinds of things to make sure we meet your needs. But it's not, I can't guarantee any safety. I can't guarantee safety in general, but I can only guarantee you that we're going to do the best that we can with all of our safety parameters. But if you can pick up and drop off, or you can find a way to get your child to school safely without interacting with other students, that's a preferred model if you can implement that. Want you to know, again, food, meals, and services. You see a lot of packaged containers here. It's going to be a lot of grab and go. The kids are going to eat in assigned area or assigned zones or in their classrooms. The younger you are, the more that you're going to be eating in your classroom. The older you are, the more you're likely going to have an assigned zone or area to eat. We're adopting cashless, touchless point of sale. If you didn't know this was important news. This is pretty cool news. Last I was told, and I believe it's the truth now, so I'm going to say that K through 8 in our school district is going to be able to receive free and reduced lunch for all students in our school district, K through 8. So if you weren't aware of that, that's something that's important for you to know. Students will be able to receive packaged meals on a routine basis, whether they're in school or they're not in school. More details to come. Final section here, just want you to know how at least I see the phased approach for us to re-entering or coming back to school. Phase 1 is really comprehensive distance learning. It starts on August 31st. While we're in comprehensive distance learning, our staff and students are working together, and we're making sure that we're following sections 1 to 3 of our blueprint and preparing all the things that we need to do to meet those requirements. We're starting to have childcare take place once staff return. Here I'm just indicating kind of how many staff members we might need per building or location, and that's something that's going to be happening for our school district, and that we're giving out technology and hotspots, and we're meeting the needs of families. We're starting our Google Classroom, and that we're also doing the Grande Learning Academy. So phase 1 is really just getting into what we're starting now. Phase 2 is really as we're getting better data from the county and state metrics, and that potentially we start to bring back students into our school, and we're bringing back even more staff to support. And so it's just really important that you know that they're coming back to that stable cohort plan, and that's likely going to happen October 5th with the students that can come based on allowable metrics requirements. And that also we're still supporting with childcare if it's just K through 3. Now we're having childcare for 4th grade through 7th grade, but we're working with our students and working with our families, and we're doing this cohort model. Phase 3 is as we get more data from the health metrics, and it's now assuming that we're meeting it for the state and we're meeting it for the district, then I assume that could happen likely after our 1st quarter or potentially after our 2nd quarter, that we are then bringing everybody back, and then we're following that stable cohort model. We're having physical instruction 5 days a week for our K through 12 students, and that we're doing all the cleaning, we're doing all the support that we need to have for students with their technology at home as well. We're ready to move into comprehensive distance learning if there's an outbreak. There's all kinds of things that we're ready for and prepared for, but that to me is a later part of what happens in our school year, assuming the metrics requirements are met. And then phase 4 to me is a full return. I honestly do not believe that we will have a full return with less parameters and restrictions until likely 21-22 school year or even later. It all depends. All depends on vaccine, all depends on safety rules and different things that come out with research on COVID. There's all kinds of things that'll come out. But my point is, I do not see a full return to school as we once knew it until next school year at best. Again, just want you to know that in every stage that we have meals provided, no matter whether we're in comprehensive distance learning or we're on site. We will follow our submitted blueprints that we have. We do want to make sure that staff have time to support their online learning as well as their in-person learning. So that's where that cohort model will be as a modified schedule so that we can attend to the needs of students that are online in a short-term or long-term distance learning, depending on their situation. Transportation will be provided for those that qualify. Just again, as a reminder, I would think of that as my last resort as a parent, just because school district will not be able to control what happens before or what happens after a student is on a bus. Cleaning and sanitizing protocols will increase as the occupancy of our buildings increase. And one more thing on just the busing is, again, I just want to make it clear that if there is an outbreak or an event and we have to shut down a cohort and that student was in a bus cohort, we will shut down that bus cohort. So just again, it's one of these things. You ride the bus. If we have to shut down that bus cohort because they're part of a cohort, it'll likely mean again that distance learning for folks. So I'm trying to make it clear. It could be bumpy. We don't always know. So what you can do is bring your child to school, drop them off and pick them up. And you can control that quite a bit more. But I know that that's a lot to ask. So I appreciate that it's a concern. Want you to just know about our contact tracing. We have deeper logistical documents on this, but just that we're gonna, if we suspect anything of going on, the individual is moved to an isolation room. They get medical assistance. We make a determination if they leave the work site or the school. We notify nurse and facilities director for all the cleanliness sanitation, and I wind up becoming aware. If it's suspected or if it's a confirmed case, we start to initiate contact tracing. We look at the areas of the building that students have been traveling in or people have traveled in, and we start to understand whether the individual resides with staff or staff at another work site. So contact tracing folks are going to do a lot of these kinds of things. The nurse works with our staff as well as our CHC Center for Human Development and then Union County Emergency Management. And we start going through this process when we have to do contact tracing, again, making it clear to the public the process that we'll be following. So getting to the end here, what we now need, based on this survey that we have right here, and again, it's all on the website. We'll put it on our social media. We'll have schools email it to parents if they have parents' emails, that we need folks to complete this survey. If you don't have that survey complete by August 13th, we're going to have schools, individual schools, just really try to figure out the preference of the family. I'm going to say this. Most of us already know that you're registered and you're enrolled. And I guess I could assume that if you don't complete the survey that you're asking for an in-person model. I could take that assumption. But what I also need to know regarding that is, do you need a computer? Do you need internet? Do you need, what do you need? And so that survey is going to allow you to be able to respond to us based on your children and based on your needs and also the preference that you have. Do you now want to go to a virtual learning now that you know more? Or do you want to stay with the hybrid on-site in-person model? So we're going to be looking to get your preferences starting now, and hopefully we're going to have them all wrapped up by August 10th. But by August 13th, we're going to be telling our staff, got to contact families that haven't indicated, and if they need to let us know if they have certain needs for technology, certain preferences with busing, whatever it might be. That survey is going to be very important for us. So I do ask that you complete the survey. We'll be preparing our schools and making adjustments based on the preferences of families. So it's important for us to get those details, that information, so that we can staff adequately and support adequately with our learning services. And as parents, need you to be engaged with all the tools and applications that we have and that we'll be supporting students with. So we will be offering support to parents. Want you to know also that in mid-August, we started a new website that will be live in mid-August. It really was actually not our decision. The provider that we were working with no longer is providing internet support. So we were forced basically to move into a new system. And what's good about it, though, is that it is far better than what we once had. And so we're going to be working with Aptigee in mid-August. They'll have our website updated. They'll have an app, a mobile app that is called ThrillShare. It'll take care of social media and phone communications as well. So that's going to be a very important tool. But look for us to have a new website and a new app to download and a new phone call system for us to use in our future based on Aptigee and the ThrillShare app. And we'll be helping people understand that very soon. And they can download the app to receive information that the district or the buildings have to send out. Thank you very much. Please submit questions again. If you have any questions to our reopening at legrandsd.org, we will reply to the sender and we will add your questions to our question and answer document located in our Path to Reopening webpage. You're always free to ask specific questions to your child's school. And then if you have any questions regarding our Virtual Learning Academy, you can contact Kelly Richards and you can contact Scott Carpenter. Go ahead, Scott, with all the questions and the answers.
As Superintendent indicated earlier in the presentation, we don't have time to get to all the questions, so we looked at major trends and we're excited to answer a few of those. We're going to keep our responses relatively brief so that we can answer as many as possible. So one of the questions that was asked by one of our families was, has the LGSD operational blueprint for school reentry in 2020 and 21 been submitted to ODE and been made public yet? The response to that is no, it has not. The blueprints were updated in June, they were updated in July, and then they were updated again on the 29th. And the requirements for the district's responses have changed. And so we have, in addition, the guidance has changed. And so we have delayed in issuing those formal blueprints. They will be approved in the next board meeting, which is next Wednesday, for our comprehensive distance learning plans, and then submitted to Public Health and ODE to be on file. We will then submit blueprints for hybrid learning in September at the September board meeting. They're relatively complete, but we want to make sure that we get the last wave of guidance that happens August 11th or 12th, whatever happens, so that they match that and that we're not recreating the wheel after that guidance comes out. If you go to the OD website and look at the blueprints that have been submitted, they're relatively few because most districts are waiting to make sure that they can follow the last piece of guidance. Another question that was submitted, has there been a platform for parents to work together with the district in providing feedback for developing the instructional plans and daily schedules? If you look in the reopening plan book that's on the website, at the back of this document, there was a pandemic planning team, as well as design team members that we list in the back of the document. In addition to those design teams at the district level, each building had parents and community members that were involved in building level planning teams. We have been highly collaborative with public health, parents, all stakeholders throughout this entire process, and are very appreciative of those that have helped contribute. The last question that we have, and then I'll shift it over to someone else. Our platform has, oh, excuse me. I'll go to Landon. Landon, there's a question here. How will TAG and IEP students be evaluated or assessed in a distance learning environment?
All right, thank you, Scott. So we're going to evaluate students similarly to how we would have, post COVID-19. So case managers will collect data, which, AKA progress monitoring on all goals, just as they have in the past. This progress monitoring will be maintained through the collaboration with gen ed teachers, as well as through direct instruction time with staff providing specially designed instruction as per the IEP. ODE will release new guidance, as mentioned a couple of times, August 11th, August 12th, that may allow for our district to have 2 testing centers, which will be able to bring kids in and assess them in the eligibility process, following all COVID-19 and public health guidelines. Our district will let's see here. So we'll know more on August 11th or 12th, and then all non-diagnostics assessments that happen in the classroom will be provided through all accommodations and modifications listed in their IEP or 504. So that was a lengthy answer, but there's a lot of detail in there, so I wanted to make sure I got it all in.
The short of it, Landon, is that we're going to have assessments and diagnostics to make sure that students qualify for SPED.
We are going to maintain that, yes, and hopefully on August 11th or 12th, we'll hear that we'll be able to do that in some testing locations around the district.
Awesome, thank you. There's a second question. Could you talk about how students on IEPs for various reasons or behaviors are supposed to get educational supports? So the student has an IEP for a wide range of services. How are they supposed to access those supports?
They'll have full access to their case managers that manage their IEP or 504. As I mentioned earlier, that may happen in a special pull-out one-on-one environment, or that may happen in a push-in in a gen ed setting. I think in times like this, the appropriate resources look a lot like family and household supports, as that is where the students will be located when they're accessing our comprehensive distance learning. So case managers and IEPs will work with families to make sure that the unique needs of that child are met and the unique resources that the child requires are accessible to them.
Awesome. And then what level of support or contact can families expect with their case managers during this time?
So next week, all school administrators will start reaching out, as well as case managers, specifically our behavior classrooms and some of our self-contained classroom case managers will begin reaching out to those families next week and start really pulling together the plan, asking questions like, what do you need? How can we support you? Are you planning on coming back to school? So parents can expect those phone calls to start to happen the first part of next week.
Awesome, thank you.
Yep.
We're going to transition to Dalton, who's the president of our LEA. Dalton, from your perspective, you worked with our group and have been a teacher for quite a while in our district. How will classes be, or can you describe synchronous and asynchronous learning from your perspective, and how that will be different from packets?
Yeah, absolutely. So synchronous is going to be live with the ability of the teacher to give some direct instruction. The teacher will be able to answer questions for students. That's sort of our live format. Asynchronous is going to be mostly pre-arranged or pre-recorded materials, video lessons that were, all the resources are available for students to do at their own pace. And so I think in this format, we're going to be able to offer both of those, because what we do synchronously is going to be recorded, and students will be able to access that asynchronously. Awesome.
One of the things that we didn't mention in the presentation that I want to make sure we mention to families is that we have spent quite a bit of resources to make sure that we have more supports to send home. We've talked a little bit about Chromebooks for people with multiple children in a family. Headphones certainly becomes a requirement. Whiteboards so that they can flash their answers on the screen. Bridges math intervention kits to send home. There's a suite of resources that we've developed to be able to send home so that they can physically engage with the learning. Dalton, another question for you. This is, distance learning in the spring was a heavy burden on parents. So during this time, during comprehensive distance learning, what as a teacher are you looking for from parents? And is that burden lessened, or is that burden even more during this comprehensive distance learning?
I think and hope and believe that it's going to be lessened. What I'm expecting as a teacher is that we have a daily connection with students. We're offering both that synchronous and asynchronous instruction. So if there's a reason that a child's not able to get on synchronously that day, they're able to access it later and still get that same instruction. We're going to be giving feedback in a more timely manner with more of a focus on grading and making sure that if a student is falling behind or struggling, that we're reaching out and connecting with parents as well. There's going to be an increased focus on building community, especially in this distance format. That's going to be really important to make sure that kids' social emotional needs are being met. We're going to have sort of self-directed lessons and instruction available for students where they're going to be able to work independently on different projects or lessons or whatever it might be. We will be communicating with students a ton and hopefully parents a ton. And then I think making sure that all the services that students are needing are going to be met is going to be another key piece of this. I think that what we need from parents right now is for them to sort of know their child's schedule, for them to be looking for communication from either the school or the teacher fairly frequently, check in if there's any concerns or if they feel like their child's falling behind, make sure that they're checking in with the teacher so we're able to get any additional support needed.
Awesome. Just really quickly in 30 seconds, what's your biggest difference between a written packet that you sent home and a video? How is that experience different for you as a teacher? What might it be for a student?
I feel more confident that there's just an increase in new learning with that support that the teacher is able to provide in either a synchronous or asynchronous format. I think it's hard for most students to be able to learn new concepts on their own, just looking at a packet. I think there was a lot of parent support that was needed just to get through the packet, and that wasn't the easiest format for either parents or students. So I think just the access to education and their peers, I think in this format is going to be much better.
Thank you, Dalton.
Yep.
Appreciate it. One of the things before I get to the next question, I just want to apologize quickly. You know, being on live TV is a first for me, and sometimes we misspeak. Earlier, I had mentioned that other districts or other online institutions may steal kids. I want to apologize for using that language. Those are parent choices, and recognize that parents have the right to choose whatever district or program they want. We fully support those choices. Forgive me for being a little bit loyal to Grande and trying to help meet the needs of all families here, but I apologize for using that word.
I will piggyback though on what you just said though, and I think it's important for the public to know this kinds of concept, at least from my perspective. You do have a choice as a family to do what's best for you. You'll always have that choice. We all need to figure out our own future and what's best for our family and our needs. But I would say it's important that you know that if you want to take care of our school district, or you want to take care of your children in our school district, it is my hope that you choose that. We're going to work hard always to figure out how to support families and their needs. We do have our own learning academy, which is likely just as good as most other learning academies, virtual learning academies. And I would ask that you give us a shot first and see what we can do to meet your needs. The reality is when we lose students, we lose funding. When we lose funding, we lose programs and services over time. And when we lose programs and services over time, we also lose staffing. So it's just a kind of there's a circle of life to what the decisions that we make. I totally support any family that needs to do what's best for them. But just know it can impact us over time if we lose students to other school districts over time as well. And we want to take care of Grande, and we want to take care of our students and our families in Grande and our staff. And we need you. It's important that you know that we need you.
Superintendent, this next question is for you. How does OD's authority over local districts regarding school reentry differ from typical oversight, recommendation, or guidance of local district policies?
That question makes me think about like the sports analogy that I just said. Like, we're going to have sports. It's just different. We have ODE, and their requirements are just a little bit different. Now, I think Division 22 applies all the requirements of FAPE or IEP, anything that has to do with full provisions of FAPE, supporting English language learners, talented and gifted programs, making sure we have curriculum. All those things still apply. It's just, are we doing it on site? Are we doing it in comprehensive distance learning? Are we doing it in a hybrid model? Do we have a short-term plan? So the new parameters around kind of the blueprints matter. we didn't have these blueprints before, and we didn't have all these parameters for blueprints before, but they're now in play based on executive orders and things that we have to follow. So we have to follow those guidance documents that are in Ready School Safe Learners. We still have to follow all federally required programs and services. We have to follow Division 22 requirements, whether they're on-site or whether they're, on-site. So I'm going to just say that we still have to work and do everything like we would as a normal school district, but we also have to consider this pandemic time and all the requirements and guidance that we're receiving from the state and implement that as well.
Awesome. Thank you, Superintendent. Another question, can Learning Academy model students change to hybrid after schools reopen for in-person instruction? The answer to that is that those transitions have to happen at the quarter or the semester mark. We really are pushing hard as a district that you need to choose which model you want to participate in, because we're going to adjust our staffing based on your preference and requirements. And if people flood back and forth between these systems, we can't staff those adequately. And so we'd ask you to really sit down and make a conscious decision about which program that you want to be a part of. Certainly at semester times, it's easy for us to make transitions and we would support those, but we can't fluctuate our staffing on a dime and need you to make that decision. Next question, can students who choose homeschool or another online charter school transfer back when schools reopen for in-person instruction? What is that transition process? The students are always welcome to transition back to their home district. And if you live in Grande, you're considered our home student, or we're your home district. We would make that process very easy. It's a simple records request, and to get those records and then get you a teacher and or a schedule if you're in secondary, and usually within 24 to 48 hours, we can have you going to school and continuing your learning and growing. So not a significant barrier. Another question was, will you be providing laptops to those who do not have one? Yes, we want every student to have technology. Now, we don't have unlimited resources, so if you have a Chromebook or device or computer that your student can use at your home, please don't ask us for one, in that we're trying to serve all students. We want to make sure that we can reach every kid. We spent quite a bit of money making sure we could increase our supply, but if you have a need, certainly we want to meet those needs. We met those needs last spring, and certainly we plan on meeting those needs again. One of the questions, or there was a group of questions around internet filters and some concern about using district devices. I'll share that we maintain, whenever a student opens our Chromebook or uses their school account to access services, so Google Classroom or Clever, that we meet the national standards for a safe and secure internet. We have to do that in order to secure E-rate funding. In addition, if it becomes apparent as we communicate with parents that there is a problem, all students are required to sign an acceptable use agreement when they get that device. So if they're misusing that device in any way, we will work with parents to form an alternative plan where we can provide maybe curriculum or materials on a thumb drive where those videos and documents can be transferred, and we don't have the burden of a Chromebook where we can get into things that maybe we shouldn't. And again, that's a discussion with individual families.
Scott, real quick, let me add at least that as it relates to hotspots and internet devices, I know that was discussed that our district is going to start trying to set up meetings as soon as possible with Frontier, with EONI, with Charter Cable. We're going to see what we can do to support any family that has internet needs that way, and see what we can do to reduce rates and to offset costs. So even if we don't have enough Wi-Fi hotspot devices, we're now going to aggressively have discussions about having supports similar to when we started distance learning in March, where a lot of companies were ready to offer free internet. I'm going to be pushing to see what we can do in our community to get free internet for our stakeholders immediately. That's a priority for me.
Awesome. There were a group of questions surrounding contact tracing and how that works. I'm going to lean a little bit on Carrie or JB, but in our district, our understanding is that a close contact is defined as being within 6 feet for more than 15 minutes. And so when we engage contact tracing, the current guidelines by ODE and Ready Schools Safe Learners is that if there was a case within a classroom, and again, we're going to be in stable cohorts if we go to classrooms, so it's limited to that classroom, that we would then do comprehensive distance learning with that classroom, quarantine them. They would quickly do contact tracing to determine if any student or staff had been within 6 feet for more than 15 minutes. And then to be able to do those investigations, as soon as completed, we would re-enter the classroom. And that those who are impacted would be the ones tested or continue conversations with local public health. We feel we can do that process very quickly because of our planning and because of our relationship with Carrie and GRH and with JB and the Emergency Management Office, that we could be very responsive to that. Do you guys have anything to add to that?
I think you did a great job covering it. That's definitely the basics. I'm expecting that we will have additional guidance and information coming out over the next month that will help support us in contact tracing. But yeah, you definitely covered it well.
The one thing I would mention, Scott, is, you know, we have had significant issues with testing capacity within the broad system. And so, you know, and Carrie could certainly speak to this more if necessary, but, you know, I wouldn't automatically expect a test. And so I think as you referred, it may be additional conversations just because our current testing system nationally, as well as statewide, is having some significant challenges.
Yeah. And JB and Carrie, in the guidance that it mentions 72 hours if you're symptomatic and those symptoms diminish or go away. It also mentions if we, in lieu of a test, if we can't test, that it's a 10-day quarantine, and that if you finish those 10 days, you have to have had no symptoms for 24 hours. Those are some of the criteria we would be using.
Yeah, absolutely. I think this is where it gets back to those basic things we've been talking about. We need to stay home if we're symptomatic, and that's what we're going to ask people to do. And if they are a close contact and we really think that they're at risk, then we will ask them to quarantine for those certain periods of time. And again, it's 10 days if you're symptomatic and you need to be isolated, and then 24 hours symptom-free, no fever, symptom improvement. And then if you need to be quarantined, it's 14 days. Now, I really want to also emphasize that there are lots of nuances to this. Like, it can depend on whether or not there are people in your household that are also contacts. So, you know, I want to make sure that people understand that the guidance might differ for your individual situation, but public health is going to be here to work through it with the families and the school to make sure that we're following the guidance.
Carrie, you mentioned something that was really important in another question, so I want to hit on it. If a sibling, let's say, you know, I have 4 daughters, so let's say one is symptomatic and maybe is part of a cohort that's going to get tested, does that automatically mean that all the sisters or all the siblings would also be quarantined?
Yeah, I mean, again, we will be waiting for guidance that is coming from ODE to really help us navigate this in the school setting and the school environment. But at this point in time, under our current investigative guidelines, if you're a household contact and there's somebody in your house that tests positive or is symptomatic or is a close contact, then yes, we would definitely be asking you to either isolate or quarantine, again, depending on your very individual situation.
Yeah. Thank you very much. And it hits on one of the things that have been a priority in the past for us. We've always been chasing that 100% attendance. It seems like for the last 20 years, we have been like, please, please, please come to school. Here's popcorn, or here's a party, or here's this, to try to make sure that we can get every kid to school, because it's such a priority for us. And while it's important, if you're sick, we're gonna work with public health with you to say, please stay home because we want everyone to be healthy. Is that good guidance from you too?
Yes.
Yeah, and I think, sorry. I just wanted
Go
to say
ahead.
really quickly, this is why the planning that our school district is doing is so key, because you guys are also going to make it possible for students to stay at home and still continue with their education. And so we've got a really nice model going here where we can have both.
Dr. Zach?
Absolutely. I did want to add, it does become tricky when you have siblings. So as a pediatrician, one of the things that is always apparent is adult legislators and adult guidelines come out for adults. They don't think of the family context or the kids until us pediatricians say, hey, well, people live real lives in real families. So what the guidance is right now is very, very tricky. So there are a couple different scenarios, but let me walk through kind of the most dramatic scenario to illustrate the point. If somebody's family has a child or an individual within that family who is symptomatic, that begins the 10-day process from the time they started symptoms to the time when the symptoms end. That 10-day process may be longer if symptoms persist. And then the quarantine, or 2 weeks, actually comes after the last day somebody is in contact with symptoms. So if you start on day 1, and let's say, a child in your household is positive through day 10, and because you're their parent, you've got to interact with them, the parent quarantine actually starts on day 10 and persists for 14 more days out from that, which would be actually day 24. So it starts adding up to approximately a month pretty quickly, which just gets me back to why it is so important to continue up the good work of distancing, masking, and minimizing anything that really falls into the non-essential category for you and your family.
Yeah, one of our past practices has been to send a 10-day drop letter when there's an attendance issue. That rule has been waived by ODE, and so as families go through these fluctuations, and you can, from Dr. Zach and from Carrie and from others, you can see how complicated this gets if there is an issue, that we will not be sort of chasing you down for attendance. Now, we want you to engage with your child's teacher, and you can do that virtually, you can do that through email, you can do that through phone, you can do that a lot of ways, and we will highly encourage you to do that, and we'll try to help you with those, but we're not going to be following up with 10-day drop letters or other program notices like that. Another question, we got 3 more left, and then we're going to go ahead and close this meeting out. One question was about training in August for teachers and for substitutes. Want to hit on that we are opting to make some changes to our calendar that we'll talk about in our next school board meeting to really front load training for teachers, to give them 4 days of PD. I want to emphasize that our teachers have been fantastic in opting to do training. We gave a great series of trainings in May to our teachers. At that point, they were elective, and many of them opted to do lots and lots of training on Google Classroom in May. The IMESD has offered a summer series on Google Classroom and electronic resources, and we've had lots of teachers participate. But we know that we haven't reached 100% saturation, and certainly we have substitutes and classified staff that need to be trained as well. And so we're going to be offering training to all staff members on August 20th, 21st, 24th, and 25th, and front load our school year to make sure we can meet those needs, including substitutes will have access to that in a virtual way or through video. A question that came up during our meeting and in the chat, this came from a parent or student regarding high school. With grades 9 through 12 in the same class all day, the same teacher, will students basically be doing distance learning while at school, or how will direct instruction take place? That's a fantastic question. So if we were to go back, we would likely have a period that's in-person learning. It would be an hour in length. It would be followed up by a second class that's an hour in length, and that the rest would be, in fact, online, like you described. But that every week, those 2 direct instruction or live classes change. So in week 1, it would be periods 1 and 2. In week 2 or 3, it would be periods 3 and 4. And in this way, we can provide at least 1 or 2 units. We think that we can get 2 to 3 rotations, at least 2, if not 3 rotations in every class, so that students can get direct instruction. A CTE class, welding, hands-on, and we want you to have those, and we want you to have it across your 7-period schedule at the high school, because there are great reasons you chose those classes, and those teachers want to see you face to face. And so there's a way we can rotate those live classes to make sure that we can stay under the 100 cohorts, but give you live instruction across all your classes. So a little bit of outside the box thinking, but we're trying to do those things so that we can maximize your learning across your 7-period schedule. Another question that came through during the meeting was, and Superintendent, I'm going to have you answer this and then give your closing remarks. The governor's office indicated yesterday that they were talking with a number of rural school districts about potential exceptions to the metrics. Is our district participating in those discussions? I'm not advocating for abandoning the county metrics, but are we advocating, and what do you think?
Okay. Well, first two, I want to hit on the high school comment that you made, and just how for the high school student that sent you the question or that we received it, that you know, we're crazy about our high school students and we want them in our schools, and that you know, we're sorry that no matter what we do, it's probably not like it used to be in terms of what we used to offer. But I want folks to kind of stick it out with us as best they can. We're going to do our best to get them on site and to get them with their teacher, at least, you know, for 2 weeks at a time, so that they can have an experience that they want to have in person with that teacher. So I do ask them that, even though it might not seem fun or it just might seem like a glorified online experience at times, we are going to be with them in person. We're going to have services for them in person. We're going to have counseling support available. We're going to have food there. We're going to help them with their graduation plans. We're going to do all kinds of things if they come on site. And we know we can give them more if they come on site. It might be bumpy, it might be different, but again, that better together. If we stick together and we stay together, I believe that's better for our long-term future, and we can support each other better if they're on site. Now back to the metrics. Yes, we're definitely, I asked to be on that committee to be advocating for county metrics changes for all of Eastern Oregon. I wasn't selected to be on that committee. Fortunately, Commissioner Andreas is on that committee, and I believe JB Brock has also been receiving feedback. Well, and we have Mark Mulvihill on that committee, and so we have been asking for things to change with the metrics requirement from that 10 out of 100 and making that better, making that, why can't that be, you know, 30 out of 100, 10 out of 100,000. Like I said before, that's 3 cases in Union County. 3 cases that's a very few, you know, cases for us to not really ever get into formal in-person learning at all. So why can't we have it be more like 30%, which would be almost, it's 8 cases for us. But why can't we have it be 8 cases? Why can't we expand these percentages so that we can get more students into our school? Why can't we have K through 5? Why can't we bring in more students? Why does it have to be? And if the data is 10 or 10 years old, 3rd graders, we don't have a lot of 3rd graders that are 10 years old. They're 8 years old. We have 4th graders that are 8 and 9 years old. We have 5th graders that are 9 and 10 years old. We should be able to do more. So we've been pushing and advocating. I have been told that the governor is considering ODE, Oregon Department of Ed, and OHA is considering changes to the metrics for rural schools. That won't come out until next Tuesday, but we'll be ready to see. What I get told, though, being realistic, I want to love to be optimistic, but also realistic, is that we're a 4A district, and we're bigger. We're bigger than Cove. And these are little things that people might not always understand. We're 5 times to 6 times bigger than Cove. Same thing for Union. We're 5 times, we have different density issues. Our population is not the same. And folks need to understand that the Oregon Health Authority, ODE, and the governor is not going to look at Grande the same that it looks like Embler or Elgin or Cove or Harper or Huntington. So our hopes are up that the metrics will change and that we can have more students in our schools as quickly as possible. But there's a lot of situational factors that have to do with that population, that location, and their own density. And I'm hopeful for LeGrand, and I think LeGrand will hopefully benefit from all of rural Eastern Oregon having changes in case number criteria, and hopefully even positive test rate criteria. And I'm optimistic, but I don't think that LeGrand will be looked at exactly the same as Cove will be looked at. I think smaller rural schools will be likely treated even better than larger small towns. So I'll stop there. So with that note, very thankful for our families. We have our reopening Legrand at legrandsd.org location where you can email us and we will be responding, and then we will also be updating and putting that on our website. We're here for you. We want to take care of you. We want to take care of our kids. We love our staff. We're proud of our school district. We've done great things. If you don't know how, I could spend hours on things that to show how we've done well in our school district for a while. And we're going to take care of people in this difficult time. I know that. But you got to stick with us. We'll do our best for you. Thank you for joining us.